Okay, so today we have Ellis Moran joining us from West Liberty University. So thanks for being with us today, Ellis.
Thank you for having me.
So to get started, could you tell us a little bit about yourself, how you became interested in behavioral health and the current field of study that you're in right now?
Sure. So, my name is Ellis. I am a transgender man. I am from the tri-state area. I actually live in Ohio. I attended West Liberty for my undergraduate psychology degree, and I returned to be part of the inaugural cohort for the Masters of Arts in Clinical Psychology program. Um, I wish I could tell you that I had always been interested in being a behavioral health professional. But other than a brief desire to be a bus driver, um, I've always wanted to be like a history teacher. And it wasn't actually until my senior year of high school that I took a psychology course and it really started to catch my interest. Um, I kind of at that point threw myself into learning everything that I could, and the more classes that I took in psychology, the more interested I became. And following graduation with my bachelor's degree, I actually worked at a crisis stabilization unit for 2.5 years, working with acute mental health care or acute mental health symptoms such as like suicidal ideation and like acute psychosis symptoms, as well as substance use populations following like overdose and people that were sent over from a hospital across the street. So
Okay, that's so interesting how, maybe just one course can totally transform the path that somebody wants to take. So I love that high schools offer things like that so that you're not maybe, 2 years into college and then take an elective and then realize, wait a minute, which, there's nothing wrong with that either. There's plenty of time to change your mind, but that's great. So sometimes there is a stigma that surrounds the field of behavioral health and or the profession. So what is your response to that, or what do you have to say about that, or your experience?
so I think that the biggest issue surrounding the field of behavioral health that leads up to the stigma is the mystery that a lot of people kind of associate with it. There's a gross misunderstanding of what actually takes place in a behavioral health like setting. And I think it's kind of attributed from the stigma that surrounds mental health as well. And like I said, just a lack of understanding for people of what like behavioral health treatment really is. Like it's not mind reading. I get people that ask me because, oh, you're studying psychology. What am I thinking? It's not how it works. Um, or, oh, so you just sit around and listen to people's problems all day. I'd love to do that. That's also not how it works. Um, Additionally, like terms that are used synonymously, such as psychologists and psychiatrists, and or oh, you're a counselor, you're a therapist, but there's really so many different subsets of behavioral health professions, and the lack of differentiation for people in a personal level, I think, is what kind of leads into that stigma. Um, Additionally, if you look at it from like a multicultural standpoint, there might be, excuse me, I'm recovering from a cold as well. um, from a multicultural standpoint, certain cultures may facilitate additional stigma towards behavioral health because it might be seen as weakness, or it might also be seen as like a slight towards the family values um, for seeking out like treatment. So I think that all of those play a key role into why there is stigma surrounding the mental health field and behavioral health as well. So it's just kind of a lack of awareness there.
Absolutely. And again, that's part of why we want to speak with people who are in the field or at least getting ready to enter in a different capacity so that knowledge is power and we want people to understand what behavioral health has to offer. So that's great. So as far as reducing that stigma, I know that you said education is important, but you're going to face barriers and challenges to do that. So what are some of the barriers that you think you will come up against?
I think one of the biggest barriers, specifically in this area and West Virginia as a whole, is that rural communities with limited access to behavioral health services it's going to be a lot harder to reach them as far as, educating on what mental health is or what it can do for you. Additionally, I feel like a lot of people might have an inability to kind of recognize symptoms in oneself as being something that needs treatment, or could be benefited by treatment. So with the rural communities, there's, you got to take into consideration the lack of availability of practitioners. You might have a handful serving a massive community just because there's no one else there to do it. Access for people to even get the services that they need. Specifically, like I said, in those rural communities, people might not have health insurance or might not be able to afford like self-pay to like get treatment or even to be able to attend like an outreach event of some sort. Also, I feel that there's a reluctance for people to kind of try to understand more about behavioral health at times. I think that also plays into what I feel is like an over exaggerated perception of what the severity of like mental illness is. For example, if you would ask somebody and they would say, "Oh, well, they've got schizophrenia. They can't, they're crazy," something like that. And just not fully understanding that there's so much more to mental health than just what's displayed in the media. It's not all, the one that flew over the cuckoo's nest. There's a lot more that goes into it. And there's a lot more people that suffer from mental health issues than I think really realize. And so we are a society that while we're getting better, we still do not prioritize mental health care as a whole. And so I feel like those are some pretty big barriers to reducing that stigma, just availability and awareness.
Right. And so I'd be curious, as far as availability and access, and of course I know broadband, transportation, and all of that plays into it, but with, the change in climate around COVID and telehealth services becoming more available, how do you feel like that will affect West Virginia positively?
I think that if there's one thing that COVID has taught us, it's to be flexible and roll with the punches. And it's also, I think, helped to highlight the deficits that West Virginia as a whole is experiencing. And I know specifically, like through West Liberty, in our behavioral health clinic, which I work in as a student, we are working with, I believe, NAMI and Wheeling to set up a like telehealth booth for people in the community to be able to access. So setting up things like that would be really helpful to helping, bridge the gap on some of these services.
Great. Wow. I've not heard of that, but that's exciting. Okay, so with all of these barriers and the stigma and everything that you're going to face in this field, how do you, as a behavioral health professional, personally plan to address some of those issues?
Well, I think that just, doing a lot of community outreach and meeting people where they're at, first of all, and not trying to force it, but also just kind of addressing it in a way that people are getting the information, but they don't feel like it's kind of being shoved down their throat, I guess. And so addressing like the common misconceptions about what it is, what we do head on, and just, dealing with them and taking questions as they come and providing like places for people, like resources for people to find their own services, or maybe even just like address that, it's a lot more than just like active psychosis. Like there's depression, there's anxiety, there's so many more like subsets, and we have the entire DSM-5 that's full of all these different things, and that still doesn't even cover everything. And so I think just, talking to people specifically instead of talking at people is going to be very helpful in helping to address this stigma.
Yeah, exactly. That's a great way to put that, to instead of at, for sure. So I'm sure you have dealt with a vast majority of clients and populations. And so once you graduate and get out into the field, what population do you look most forward to serving?
So this answer has changed over the years, and I originally thought that I would love to work with kids, and I'm no longer sure that that's what I really want to do. When I graduated from undergrad, I was not expecting to work with the substance abuse population. I didn't feel that I knew anything about the substance use population. And in the 2.5 years that I worked there, I kind of realized that, some of the best people that I had met had sat in the group room chairs before me. Some of the worst people I had met had sat in those chairs. But you know what? That's not the important part. The important part is that um, they're a community that is in vast need, and I really did enjoy working with them. Additionally, I would also like to work with the LGBTQIA plus community. I think that that is another community that is, first of all, at risk, but also there's a lot of stigma surrounding it as well. And with the healthcare disparities and unfair treatment in the community, I just feel like they're a community that needs attention, and that's a community that I really look forward to working with as a queer individual myself.
Great. And and I agree that is something that West Virginia really needs. So, all populations need behavioral health, but I feel like your experience so far, in your acute crisis unit and everything, you're going to have so much to offer. So we're very looking forward to having you out in the field again. But so as it relates to your profession, where do you see yourself in 5 years from now?
5 years from now, well, first of all, so I'll be graduating with my degree, I believe, next spring, because we start our fall internship in the fall. And, yeah, fall internship in the fall. Um, we, after graduating in West Virginia, will be under supervision for 5 years. But I really, and I know that I've recently learned that I'm already eligible to do this. I just do not have the time to do it right now. Going kind of back to that teaching element that I was interested in, I really like to teach at a university level. Like teach some psychology courses, maybe some like personality psych, some history of psych, and just kind of, take something that I was already always interested in and combine it with what I've chosen to do as a career. And additionally, to teaching, I would like to provide behavioral health services to communities I feel are most at risk, like the LGBTQIA plus community, specifically teenagers, and adults, like young adults. I just feel that there's, especially in West Virginia, that there's having some fresh finds and fresh perspectives on things is going to be really helpful to helping the state grow as a whole.
Absolutely. Yeah. Okay, Alice. Well, thank you so much for joining us today. And we look forward to seeing you out in the field again in the future.
Well, thank you. I appreciate that. And it's been nice talking with you. And thank you for the opportunity.
Great. Thank you.
Thank you.